Hi, Mrs. Williams. How are you?
Good.
I know you're just getting ready for discharge, but I just wanted to go over some things, before you head out of here. So I know you were just recently diagnosed with diabetes. I'm sure the doctor went over with you, but I just wanted to go over and confirm that you understand what it is. So diabetes is when our body doesn't produce enough insulin, or the insulin that is produced isn't used correctly.
Okay.
So what happens is that we ingest food gets broken down into glucose. That glucose resides in the blood until the pancreas is signaled for the insulin to be released, where then insulin is the transporter and transports that glucose to our cells and tissues to maintain our metabolic functions, essential for life. Okay. So you have type 2. Type 2 is typically diagnosed in adulthood. And it occurs when the body produces insulin, but that insulin isn't used correctly or efficiently. It is about 90 to 95% of diabetes diagnoses, and it is, typically due to your lifestyle habits and can be managed with a change in lifestyle habits. Okay. So risk factors. I'm just going to go over some. Family history is one. Did you have any family history of diabetes?
Yeah, my grandma had diabetes.
Oh, okay. All right. So it does run in the family. Age is 1, above 45, they say that you have a higher chance of getting diabetes, which I know that you are 50, so we see that there. Hyperlipidemia, which is just high cholesterol, and I see that you have a past medical history of hypercholesterol. Okay. Hypertension is another. I saw today in your vitals you're about pre-hypertensive. So some of these habits or lifestyle modifications I'm going to go over will also help decrease that chance of you becoming hypertensive if you're able to follow through. Okay. Obesity. I noticed that your BMI is higher for your weight and height distribution. So that is a risk factor. Have you considered weight loss, or does that interest you at all?
Yes. Yep.
Yes. Okay. So we'll go over some things that hopefully will help with that as well. Sedentary lifestyle and diet are other risk factors, okay? Can you tell me about your diet?
I eat a lot of fast food.
Okay.
I don't cook very much.
Okay. So a diet high in red meat, high fat dairy, sweetened beverages, desserts, and processed foods give you a greater risk for diabetes, and also will exacerbate your diabetic symptoms. So if you can incorporate, or you get, those meal prep plans for quicker, easier meals that have that veggie, that have those whole grains, a fish like salmon is great. It's a great source of protein, and also better for you than those increased red meat products. Okay. All right, so I'm just going to go over some signs and symptoms of the different signs and symptoms of what you could experience. So hypoglycemia, that's just another term for a decrease in blood sugar. That occurs, you'll see sweating, pallor, irritability, hunger, sleepiness, and lack of concentration. Okay, that typically is counteracted by eating something, because you do have those low blood sugars. You just need a little bite to eat. Hyperglycemia, you would experience, which is is another term for increase in your blood sugars. You would experience dry mouth, increase in thirst, weakness, headache, blurred vision, and frequent urination. That is typically when you would most likely need that insulin to bring it down. Are you able to tell me about 2 to 3 signs and symptoms of the hypoglycemia, the low blood sugar?
Shakiness, hunger. That's when I need a snack.
Yeah, great. And then hyperglycemia, that high blood sugar, can you tell me 2 to 3?
Headache, dry mouth.
Great. And with that dry mouth, you'll probably be thirsty. Okay. I know some people keep a little snack in their purse or crackers. I think that would work well in case you ever have that hypoglycemic event. All right. Your blood sugars normal should be between 65 and 100. Unfortunately, yours are not there, but that doesn't mean it can't get there with those lifestyle modifications. To test for those blood sugars, we use our glucometer. Okay. You'll have the main brains here. All right, and then our finger pricks. Okay. alcohol swab. So first, I'm just going to demonstrate on myself and not really prick myself. You want to clean the area where you're going to prick. Typically, a fingertip is fine. Okay. Then you will. Well, let me get my little readers so that'd be easier. You don't want to, put blood everywhere. All right. So now you will twist off the pinprick. Put it against your skin vertically. Push down this purple lever. That means that little pinprick went. You want to wipe away the first little drop of blood. If you need more blood, just squeeze your finger. And you'll take that purple little, little raised lip guide. You see that?
Okay.
And that's where you'll put against the skin for that blood to reach in. There's a little bullseye that you see at the end of that white capillary strip. And that's where that blood will fill, and you want to get it filled in there.
Okay.
You'll then take your strip, put it in your reading like this. You want that tip to be out. It won't fit it that way. And that's it. And it will read your blood glucose levels, okay?
Okay.
Do you want to come demonstrate on me?
Sure.
All right. Get this out of your way.
So clean the
There you
fingertip with
Yeah.
alcohol. Doesn't matter which finger.
No. And
Okay.
if you're having soreness on that finger, rotate sites.
You got one of these out?
You don't want to keep pinpricking the same.
Yeah. Okay.
Don't want to cause yourself more pain than you have to with this prick.
Okay. So then just push straight down.
Yep, perfect.
And then wipe the first
Yes, yep.
drop of blood, and then put blood onto this little arrow here.
Great.
Get it into the bullseye,
Yes.
and then put it into the reader like that, and then it'll tell me.
Yep, it will tell you your blood glucose levels, okay?
Okay.
Do you have any questions for me today? Any concerns?
I don't think so.
All right, well, you have a good one, Mrs. Williams, and I hope this improves for you, okay?
Okay, thank
All
you.
right,
I
you're
appreciate it.
welcome.